Hi, I'm Dr. Ava Giugliano. I'm a neurologist with TeleSpecialists, and I'm here to talk a little bit about post-stroke recovery. So after a patient has a stroke, it can be very daunting for the patient and their family. They have a lot of questions for us regarding, what comes next, what recovery looks like, how long it will take, things like that. So first of all, when the patient's still in the hospital, there's a whole team that will assess them to see, what deficits they have or, what weaknesses they have, what trouble they'll have when they're discharged. And that helps determine where they will go next. So first, they're assessed by physical therapy. Physical therapy mainly focuses on your ability to ambulate, to get around. Occupational therapy assesses your ability to take care of yourself in your daily life, things like brushing your teeth, cooking. And then speech therapy will look at patients' ability to speak, but then also their ability to swallow safely. So we need all three of those therapies to come together, see the patient while they're in the hospital. So sometimes, although, I know patients want to get out of the hospital as soon as possible, it's important for all of those teams to see them to make sure we get them to the best place next, and that we know what all needs to be worked on so that they can get back to the best recovery as possible. So one of the most common questions I get after patients have a stroke is, how long will it take to recover and to get stronger again? So after having a stroke, we know that the body has about 3 to 6 months to regain as much as possible. After that, you could still definitely make some strides in regaining your weakness, but it's in those first few months that are most important. It can be a lot at first, and sometimes patients just want to get home as fast as possible, but if you could stick with it and go to the inpatient rehabilitation center next, then we know that you'll get the most physical therapy in during that window of important time after the stroke. Everyone's post-stroke recovery is variable. That being said, we know that after decades of research so far, the most important things for stroke recovery is remaining active and consistency with the physical therapy that you're prescribed, and exercise afterwards. One thing that I've noticed in patients that have done well after stroke recovery is that they seem to have a new mindset after their stroke, that this is kind of a second chance to have a new outlook on life, and they've found a new resiliency in the ability to continue to live and improve and regain their strength no matter what life throws at them. And I feel like they really do that with a positive mindset and a good support system around them.